Dr. Akash N. Singh, sir, for next. Sir, please.
So welcome everybody. This is a IDCM CM India joint symposia, and the first talk in this session will be taken by Dr. Bhagirath Solanki. So I request him to be on the stage. If I can have his CV. Dr. Bhagirath Solanki is Professor of Medicine at BJ Medical College, which is the biggest medical college in Gujarat and one of the biggest in India. And he is an astute academician and has many publications to his credit. A lot of his students are doing exceedingly well all over India and internationally. And he also has talks on several platforms. And he is also a close associate, and we are working all together as far as the academics is concerned. So I request him to come and deliver his talk on endothelial function and arterial stiffness in metabolic syndrome.
Thank you, Dr. Akash. At the outset, I am thankful to Dr. Ashutosh Mishra and Dr. Pallavi Mishra for inviting me here to share my views. So, topic is endothelial function and arterial stiffness. Okay. So, endothelial function, we know the endothelium is a lining in our arteries, arterioles and capillaries, is having a very big surface area. So my objective here is to go through the endothelial physiology, mechanism of endothelial dysfunction, which would be purely molecular basis, and arterial stiffness. We know the stiffness is actually here equivalent to a blood pressure, because anything stiff will have an impact on pressure, and a concept of vascular aging apart from the chronological age. So we know about the atherosclerosis, the beat of atherosclerosis, arteriosclerosis and other degeneration, the impact of metabolic disorders, and we will look into the how to clinically assess and what will be the strategies. Vascular endothelium is a single line and is in an adult almost 1000 meters square in an adult, very big area. But what is the function? It maintains the vascular tone, the homeostasis, that is the antithrombotic activity, inflammation. It will have an impact on pro versus anti, depends on the local mediators it can release, permeability, immune cell trafficking, and it itself will act like a big organ. The function of the endothelium is to maintain the vascular homeostasis via balance, vasoconstrictor and vasodilator. These are the substances which are released from the endothelial itself, and the vasodilator substances, as in afternoon lecture has been stressed, is nitric oxide. Dr. Jumani, when he was sexual dysfunction, he was talking of nitric oxide. The prostacyclin and endothelium derived hyperpolarizing factors. The vasoconstrictors are endothelin 1, angiotensin 2, thromboxane A2. The balance of these factors is responsible for vascular tone. Nitric oxide pathway, this all is a molecular thing, and it ultimately causes increase in cyclic GMP, and that causes the smooth muscle relaxation, and this smooth muscle relaxation will allowing the better flow into the tissues and organs. So loss of nitric oxide bioavailability leads to vasoconstriction, and over a long run will result in vascular stiffness. The endothelium which we have seen is a part of intima, we know media and adventitia, they also will have some role because tunica media contains very much smooth muscles and elastin and collagen, and these smooth muscles are getting proliferated and invaded by the fat-laden cells and foam cells, and they create a plaque, and that is where the atherosclerosis starts in. Tunica adventitia is again a tough covering, and that contains the fibroblast and immune cells. And we should not forget that perivascular adipose tissue, because till now in recent time we have understood the deposition of fat which is dysfunctional is around the heart, kidney, within pancreas, within liver, but it is around arteries also. So that is also making an impact. So arterioles actually are the small and medium sized vessels, very small arteries, and they deliver the blood to the capillaries and have very little elastic tissue, but there is a thick layer of smooth muscle, and regulation of flow from these arteries to capillaries is regulating the resistance according to the metabolic needs of the tissue, where earlier I have described the vasodilator, vasoconstrictor factors. These factors are going to decide the vascular tone. Now we'll have some physics law. There is known as Wien-Kessel function, in which the large arteries which is getting a pulsatile flow with the stroke volume, every stroke volume is ejected into the aorta, and it is happening periodical, it is happening at a frequency, it is not continuously happening, it is not linearly happening, it is happening in pieces. So this causing the expansion of aorta during systole and elastic recoil during the diastole, and this is responsible for maintaining the coronary perfusion, and it reduces the pulsatile stress, and loss of this function lead to the arterial stiffness. This is better explained here, that how during the stroke volume ejection or during the systole the aorta get bulged, and then there is a elastic recoil. When over the period of time there are changes happening, and this is causing it as a stiffness of the arteries. So how we define the arterial stiffness is refers to the loss of arterial elasticity caused by structural changes, which at a pathophysiological level because of elastin fragmentation, collagen deposition, or maybe calcification, or functional changes where the endothelial function and smooth muscle remodeling is responsible for changes towards the arterial stiffness. Now atherosclerosis, I already told that it is within the lumen or subluminal, but arteriosclerosis is happening mostly, is measured in the carotid, aorta and femoral larger artery, and it is measured with a pulse wave velocity and cardio ankle velocity index. Pulse wave analysis also is used. The in crude clinical method we are using is ankle brachial index, and all who are practicing in diabetes, they know that ankle brachial index become one of the soft endpoint of deciding whether patient have ASCVD, subclinical ASCVD or not. Endothelial function tests are only not available as a clinical tool, they are all in research. Atherosclerosis we are measuring on Doppler study by carotid artery, in aorta, femoral artery we can measure the flow, and intima media thickness is used in carotid. Intima media thickness is acceptable as a ASCVD marker. Now how to measure the arterial stiffness? We have talked of the endothelial function. Now we want to know, there is only one method, that is a pulse wave velocity, and this pulse wave velocity is measured by sonography and aided by sonography and certain gadgets which will give you the pulse wave velocity. There are other parameters also, augmentation index, central blood pressure, arterial compliance, but out of all, PWV, that is a pulse wave velocity, in current time is considered as a gold standard for the arterial stiffness measurement. Central blood pressure monitoring was, I think, was available somewhere in 2005 in certain conferences. They are putting some sonography electrodes over here and were measuring the pressure in aorta. So, central aortic blood pressure is measured at the root of aorta by directly affecting the, directly putting the sonography gadgets on the heart area, precordial area, and that will give you the better assessment of the blood supply of the important organs like heart, brain and kidney. It is more accurate and sensitive predictor of CV risk and target organ damage than the conventional blood pressure measurement where we use the brachial artery. So what is pulse wave velocity? Is just to explain, it is a distance upon transit time. It is a non-invasive clinical measurement of speed at which the blood pressure pulse travel through the arterial tree. And the speed of pressure where is generated because of the cardiac systole. It is measured in carotid or femoral focusing the aorta. It can be measured in brachial and ankle, also known as brachial ankle pulse wave velocity. Now here the term, the pulse wave velocity, if it is lower, the arteries are softer and flexible. If pulse wave velocity are higher, then it indicates the reduced compliance, arterial compliance, increased stiffness and high cardiovascular risk. Means stiff artery are going to make the pulse wave go through and faster along the arterial tree. Endothelial dysfunction, these are the key features that reduce nitrous oxide, the reactive oxygen species, other adhesion molecules, prothrombotic state. So this is because of oxidative stress, chronic inflammation, RAS activation, insulin resistance, lipid abnormality. All this would interfere with the endothelial function, and this endothelial function is ultimately is responsible for arterial stiffness because it interferes with the vascular remodeling. The vascular smooth muscle change is this endothelial dysfunction causes vascular smooth muscle phenotyping switching, and contractile is become increase in proliferation, more extracellular matrix production, vascular remodeling ultimately lead to the arterial stiffness. So this is what is the molecule responsible for this extracellular matrix remodeling are elastin degradation, increased collagen deposition, cross-linking of proteins and fibrosis, and these structural alterations ultimately lead to the vascular or arterial stiffness. There is a role of inflammatory milieu also, the chronic low-grade inflammation because of IL-6, TNF alpha, MCP1, CRP, these also affect the endothelial function and vascular remodeling. Metabolic disorders, yes, this becomes ultimately a base, and that is what the adipocytes, sugar, lipids, blood pressure, and overall we label it as a metabolic syndrome. Diabetes is also altering the endothelial dysfunction by causing advanced glycation end products, hyperglycemia, oxidative stress, insulin resistance, and age are the cross-linking of collagen and arterial stiffening. Obesity, again, low-grade chronic inflammation, oxidative stress, activation of RAS, and I say the perivascular adipose tissue dysfunction that also make them susceptible to arterial stiffness. So this is about the role of perivascular adipose tissue. This is which molecules are responsible and which molecules are released and responsible for increasing the stiffness. So overall, this stiffness arterial is responsible because of that. There is it is because of aging, because of blood pressure, because of obesity, because of metabolic syndrome. In female, again, there are added things like preeclampsia, PCOS, endometriosis, and autoimmune disorder. All these toxic environment are responsible for arterial stiffness. Now what clinical consequences? Hypertension, coronary artery disease, heart failure, stroke, CKD, AF. So this is just explained in that carton. and all this responsible for end organ damage, micro and macrovascular uh, complications, left ventricular hypertrophy, cognitive decline, renal impairment, retinal impairment, peripheral artery disease. So this is a vicious cycle. In this, one more thing which I want to draw the attention, that hemodynamic stress, the blood pressure variability. In last 5 years we have come with the glucose variability. The same way the concept of the hemodynamic variability have also come. The fluctuations in blood pressure beyond the range is responsible for accelerating the arterial stiffness, and that causes the cardiac overload and increase in NT-proBNP. So therapeutic approaches, LSM, that is lifestyle modification, weight reduction, exercise, smoking, cessation, healthy diet, all this improves the endothelial function and reduce the arterial stiffness. This is one study I have come across in which the arterial stiffness is improved after the exercise in an older woman after 6 months of exercise. So arterial stiffness is, when the graph is going up, is reduced, and when on x-axis when it comes down, it improves. So improvement is there over after 6 months. Pharmacologic therapies are ACE, ARBs, statins, SGLT2 and GLP-1, because most of them targets to the variety of the parameters which we have discussed. So what are the emerging therapies in this area? Are anti-inflammatory drugs, antioxidative agents, senolytics, and targeted metabolic therapies. Means this area is coming up. And this is the how to consider the vascular age. Currently only one parameter. There are various scales in which the age, gender, smoking, and the cholesterol and LDL ratio, such parameters are there, and by which the numerically you are going to calculate the vascular age according to the score. But if we want to currently show about any single test, then it is the pulse wave velocity. But in future time, after searching through the literature, what I come across, maybe this is non-invasive, but one invasive test can be considered as a very important for vascular age, that is NT-proBNP. If NT-proBNP more than 125 microgram, then it does not indicate anything, but it indicates increase in CV mortality. And that is a reflection of the blood pressure variability, which is extreme, which previously I showed in my slide. So there is a blue is a normal vascular aging, then in higher rate of CV and where early vascular aging, and then there are supernova, super normal vascular aging. But of course this all is because of this pulse wave velocity, which is measured on carotid or femoral arteries, and it is an upcoming tool for clinical assessment for primordial prevention. This is a tool for the preventive cardiology and preventing the MACE and 3-point and 5-point MACE. So हो गया नहीं just 1 minute, last slide is there, just please last. Okay. यहाँ से करते हैं, अभी और नीचे, just आकाश few seconds, अभी और नीचे और नीचे, ये यहाँ पे करो, हाँ इसको बताओ, इससे नीचे जाना है, स्लाइड शो करो, स्लाइड शो, अब नीचे इसकी बात की स्लाइड करो, ठीक है चलेगा. So take home message is endothelial dysfunction is central to vascular disease. Metabolic disorders accelerate the vascular aging. Arterial stiffness is an independent cardiovascular risk factor. Early detection and management improve the outcome. Probably we have many therapeutic modalities currently available, but how to measure the vascular stiffness improvement, that is evolving. Thank you very much.
Thank you, Dr. Bhagirath Solanki, sir. If there are any question, the house is open for that. If there are no question, then I will request Dr. Akash Singh to take the podium.
So there was this